Good afternoon. My name is Angela Taylor, and today I'll be doing a journal club on a landmarks nutrition study, the Women's Health Initiative, and the specific paper that I'll be covering is the low-fat dietary pattern and risk of invasive breast cancer, the Women's Health Initiative Randomized Controlled Dietary Modification Trial. So here's an introduction to the Women's Health Initiative. In 1991, NIH launched the Women's Health Initiative, and they enrolled over 160,000 postmenopausal women who were aged between 50 and 79 years old. The study ran for 15 years, and it was the largest women's health prevention study ever. So they wanted to study common postmenopausal diseases, including cardiovascular disease, which is the leading cause of death among U.S. women, breast cancer, which is the second leading cause of cancer deaths in the U.S., colorectal cancer, which is the third leading cause of cancer death among U.S. women, and osteoporosis, the leading cause of bone fracture in U.S. women. So here's a little bit more of an overview on the overall study. So the Women's Health Initiative was actually an umbrella under which many things were operating. So we had 3 RCTs and 1 observational study, all of which were housed under this Women's Health Initiative. Now, one of the RCTs, which is not the one that's in our paper, that's in today's paper that we were asked to cover for our assignment, but one of the RCTs was studying synthetic hormone replacement using estrogen plus progestin in healthy postmenopausal women. And we were asked to cover gaps in the study. So this Women's Health Initiative, in my clinical experience, does have a gap, which I will now explain to you. So the Women's Health Initiative results in the year 2002, remember it started back in 1991. So in 2002, they found that the women who were taking this combination synthetic hormone therapy, which was estrogen and progestin for menopause symptoms, had, yes, some good things, decreased risk of fractures and colorectal cancer. However, these women also were displaying an increased risk for breast cancer, heart disease, stroke, blood clots, and urinary incontinence. Okay, so let me try and explain the issue here to you guys. Progestin is a synthetic and it's non-bioidentical version of progesterone. So progesterone is a natural hormone that's made by women. Okay, progestins do not reproduce, unfortunately, the same actions of natural progesterone. And you can see here that the shape is quite different, right? The chemical structure, the formula here, okay? So studies have shown that progesterone, natural progesterone, does not induce estrogen-stimulated breast cell proliferation. And there are many advantages of natural progesterone, bioidentical progesterone, including it balances estrogen, it lowers high blood pressure, it lowers cholesterol, it's anti-inflammatory, it's neuroprotective, and it promotes myelination of the nerves. So that I thought was a pretty big gap in this study, in that they chose to have the women take progestin, and then they encountered a safety issue and told everybody to stop taking hormones, which I think is very sad, because if the correct hormones are given, then they actually have a great deal of benefit, potentially. Okay, but getting back to the particular study that we were asked to cover for our assignment, it is the low-fat dietary pattern and risk of invasive breast cancer. So here it is, and now we shall continue. The study objective. Researchers wanted to assess the effects of consuming a low-fat dietary pattern on breast cancer incidence. So they, of course, had to enroll women. So this was their participant flow. So this is overall the chart showing the flow. And first I'm going to cover the exclusion criteria, which is this top area here. All right. Okay. So as you can see, we had approximately 373,000 women who filled out the screening form. Okay. And whoop, we researchers booted out about 316,000 of them, which is a lot, right? And now we're down to 56,000 approximately. And then researchers excluded even more, about 7,000 more. And you may be worried, you're thinking, well, gosh, how are they going to have anybody left? But guess what? They actually reached 102% of their enrollment goal. Check that out. Look. So they ended up with approximately 48,000, well, exactly 48,835 eligible women. And they randomized these women to two groups. They divided them into the low-fat intervention group and the comparison group, which was you get your usual diet and we're not giving you any diet advice, okay? And by the way, they purposefully assigned 40% of the women to the low-fat diet and 60% to the control group. All right, so here was the intervention, and for those who were in the intervention group. It was designed to promote dietary change with these goals: to reduce the intake of total fat to 20% of energy, to increase consumption of vegetables and fruit to at least 5 servings per day, and to increase consumption of grains to at least 6 servings daily. The comparison group participants weren't asked to make any dietary changes. So here are the results. Dietary fat intake was significantly lower in the dietary modification intervention group compared with the comparison group. And the difference between the groups, let's take a look at the chart here, okay? We've got, when people came in on day 0, their baseline, they were consuming, this is an average of everyone, okay? 37.8% of their energy was from fat, of their calories, okay? So now we look at year 1, everybody's gotten their instructions of what the researchers would like them to do. And at year 1, wow, they really reduced their fat consumption. They reduced it by 10.7%. But as the years go on, you can see people are getting a little bit more lax. And by the time we get to year 6, their fat consumption reduction was a little bit less. So now they're only consuming 8.1% less than they were at baseline. Here's some more results. Vegetable and fruit consumption was higher in the intervention group by at least 1 serving per day. And a smaller difference, like less than 1 serving per day, was found for grain consumption. And finally, the numbers I think we're all the most interested in are the breast cancer rates. So the number of women who developed invasive breast cancer, and this is an annualized incidence rate, over the 8-year average follow-up period was 0.42% in the low-fat intervention group and 0.45% in the comparison group. So this was not found to be not significant. Okay, they also did some secondary analyses which suggested a lower hazard ratio among adherent women, that the secondary analysis provides greater evidence of risk reduction among women who had a higher fat diet at baseline, and it suggested a dietary effect that varies by hormone receptor characteristics of the tumor. Okay, so let me break this down here. Adherent women would be people who were following the low-fat dietary pattern that was conveyed to them, okay? And tumors, hormone receptor characteristics. Tumors can be estrogen receptor positive or negative, or progesterone receptor positive or negative, okay? So when people do breast cancer treatment, if they have an estrogen receptor positive tumor, then they might be given a therapy that blocks estrogen. If they have a progesterone receptor positive tumor, my mother actually had breast cancer, and her functional doc said, oh, that's good that your tumor is progesterone receptor positive, because progesterone, bioidentical, according to him and his clinical experience, progesterone, natural bioidentical progesterone, not progestin, progesterone is beneficial. And actually she, under his care, was able to live for 4 years beyond her stage 4 diagnosis. Anyway, in conclusion, in postmenopausal women, a low-fat dietary pattern didn't result in a statistically significant reduction of breast cancer risk over an 8-year average follow-up period. However, the researchers stated in their paper, the non-significant trends observed suggested possible reduced risk. Possible, but it wasn't significant, suggested possible reduced risk associated with consuming a low-fat diet. And the researchers hypothesize that possibly a longer timeline follow-up may show a larger comparison. I don't know that clinically I agree with that hypothesis. Let's take a look. We were asked to say, is this study relevant? And I'm going to go ahead and say this study is irrelevant to clinical application. And I'm going to go ahead and cite here the work of Thomas Seyfried, who is a big advocate of using metabolic therapies for cancer treatment, such as carb reduction and glutamine reduction, and sugar reduction, right? On the theory that all of those actually feed the cancer. And then I'll also refer you to the work of Miriam Kalamian, who's written this fantastic book called Keto for Cancer. So both of these approaches actually are not a low-fat approach. Quite the contrary. They are a high-fat, low-carb, I would say gluten-free, and also nutrient-dense approach to medical nutrition therapy. All right, so that's it for today's Journal Club. Here are my references. Should you wish to contact me, you may reach out to me via email. So thank you very much for your time and attention, and have a wonderful day.